All right. Good afternoon and good morning, everyone. Welcome to It's Worth a Shot. It's our 137th episode. We are excited today to be talking about the components of an infection prevention program. And then we are also going to show you guys one of our updated resources. So we're happy to have you guys joining us today. Let's go ahead and go to the next slide. So just as a reminder, this is our disclaimer. This presentation may contain information and or content supplied by third parties, which today we do have a guest speaker with us. So the information provided does not necessarily constitute endorsement or recommendation by Mountain Pacific. Let's go ahead and go to the next slide. Just a couple of updates and reminders. CMS is hosting a skilled nursing facility long-term care open door forum. This one, if you guys remember, was originally scheduled back in September. This is their updated one. They had originally canceled the first one. So make sure you guys get registered and tune in to that. And Jamie is going to drop all of the links in the chat for us. So make sure you guys pay attention to the chat and grab those links so you guys can get registered. The other one is a training from PharMerica. It's on infection prevention, back to basics. So very timely, it goes with our topic today. So we wanted to make sure you guys saw that information. Let's go ahead and go to the next slide. So this one is just a reminder. The original NHSN webinars have already played. These ones are the recording for these trainings. So one of them is on the person level updates, and then one of them is on just the updates for the fourth quarter. So you want to make sure you tune into those. One is the webinar replay, and then the other one is the original. So again, make sure you guys get registered for those. You want to make sure you're doing your NHSN reporting. We were just discussing that NHSN reporting is one of the most cited nationwide FTAGs for long-term care facilities. So we want to make sure we're doing a good job of this. And if you guys need assistance, reach out to your account managers and we would love to get you guys assistance and help with that. So let's go ahead and go to the next slide. So a couple of housekeeping items. Just as a reminder, we appreciate your feedback. We will put the evaluation in the chat at the end of our presentation. If you guys have ideas of things that you would like to see, make sure you put those in the evaluation. And we always take a look at those. Let's go ahead and launch our polling question for today.
There's no polling questions today, Callie.
Oh, okay. Thank you. I think we were gonna just remind everybody that next week is our infection prevention week. So we want to make sure you guys have taken a look at that and you guys have some good plans. So if you guys have any fun ideas of how you're celebrating infection prevention, be sure to put those in the chat and share with everyone on the call today. So taking a look at our weekly influenza snapshot, we're looking pretty stable across the United States for that. So that's wonderful. 0 per 100,000 on our hospitalization rate. So good work, everyone. Let's go ahead and take a look at our COVID. So kind of the same. We've had some little blips up and down over the past little while, but we are tapering off. Although talking with some of our states, I've heard from some of our nursing facilities that they've had outbreaks here recently, so that may be on the rise here in the next couple of weeks. So, but overall, our snapshot is showing pretty good. So, all right, let's go ahead and go to the next slide. And I would like to introduce Kelly O'Leary. She's coming back to present for us today. So we are going to be talking about components of an infection prevention program, and I will turn it over to Kelly.
Hey, thanks, Callie. And I just want to come off screen and just wave and say hello to everybody. There's 55 people on this call. That is great. And I'm going to go off camera because I know sometimes bandwidth is challenging with camera on. So next slide. Not only is Callie going to talk about the updated IP guide and checklist, we also thought this was somewhat timely with infection prevention next week. That's our big week to celebrate everything that we do. And so if you're an IP or you're a director of nursing on this call, it's just a good reminder to recognize all those things that your infection preventionist does for your program. And if you can put in chat, I'm going to ask a question here. So you see the what do IPs do? And with safety advocacy, certainly in the middle, you are an advocate for the resident or patient, the staff, and just overall the facility. You got to keep an eye on all things that are going on. So when you look at this list here, you've got healthcare quality, epidemiology, leadership, emergency management, environment of care, education, and healthcare associated infections. Will you put in chat, what do you spend if you're the IP or if you're the DON? What does your IP, but what do you spend most of your day on? So pick, what topic is it? Quality, which would be performance improvement, epidemiology, which could be surveillance, leadership, maybe that's policy, emergency management. Now we've got H5N1 to worry about, and Marburg, and environment of care, education, or, those healthcare associated infections, hand hygiene, or antimicrobial stewardship. So I'm just going to take a peek at chat here. HAIs and quality, epidemiology, so surveillance, quality. What else? What do you spend most of your time on? Surveillance and vaccines, outbreaks. Oh gosh. Before I thought I wanted experience in outbreaks, that was before COVID. Now I don't care to have another outbreak. COVID immunizations, what do you spend most of your time doing? So it really, how do you get to all of this stuff? Because this is your program. So most of you guys might wear multiple hats. Maybe you have some extra help. Maybe you need to delegate some things. But just wanted to remind, as infection prevention is next week, give a, pat on your back. You guys have done a great job for your facility, and keep up the good work, because, there's a lot of things that we have to really be champions on. And then who do we work with is just a reminder that we can't do it alone. And, certainly reach out to partners. I think IPs are really good at reaching across state lines to say, hey, can you borrow, or can I borrow a policy, or do you have a form that you can send me? That's what I really love about the IP community. So don't be scared to reach out, even across, all of the Mountain Pacific states. But when we look at regulatory agencies, yeah, we've got to deal with them. Community partners, and that's your, local health departments is a community partner, but Mountain Pacific. So just want to highlight that you can't do it alone. And a quote that I just heard yesterday was, infection prevention is a relationship building career. So I thought that was a good statement. Next slide. I don't know if you guys have seen this one, but this is always a good reminder for us in that, and who's the boss? Who's the top dog? Who do we really have to pay attention to when it comes to your program? And we deal a lot with the CDC guidelines, but it's just a good reminder who's on top. What do we have to do? And what are maybe those considerations? So the rules and regs, that's going to be your FDA, OSHA, bloodborne pathogen laws and regulations. Then your conditions of participation. So that's all your CMS regulations. Maybe we've got a mix on this call with critical access and long-term care. And then we've got our manufacturer's instructions for use, or the latest, we call it IFUs. So that's, how do you clean this ice machine? Well, let's go back to the IFUs and see what they tell us. So that's an IPs, it's part of our vernacular is what do the IFUs say? And then we've got our CDC guidelines and other guidelines, SHE guidelines, I like to refer to as well, that just trickle down to your facility policy and protocols. Next slide. I did a little snippet of critical access and long-term care from your conditions of participation or from CMS. So this is the critical access one. And it's in red font because it's brand new language, and they came out with this in 2020. So it's fairly new for critical access to have an official infection prevention program. They also pull out the stewardship in the language, but a couple things I just want to point out here, because the language is similar in the long-term care conditions of participation, but essentially you have a facility-wide program. So that means you're looking at everything, all infections, all areas, employee health included, for surveillance, prevention, control of healthcare-associated infections. And then it goes on to talk about stewardship. And then that last sentence is that you have a facility-wide quality assessment. And of course, you report up to QAPI or your performance improvement group. So it's an assessment that we'll focus on a little bit in this presentation, because that will drive your program and activities for the year. Next slide. This is the long-term care section. Similar in that you have to maintain an infection prevention program that is comprehensive. And here it has the following elements listed. And essentially it's the control of infections, communicable diseases in resident staff and volunteers, visitors. So I think volunteers may tend to get somewhat forgotten. We focus a lot on visitors. But you see in that last sentence too, it talks about the things that we do are based on a facility assessment. Next slide. So I'm going to show you a couple different risk assessments. And if you can put in chat, do you have a risk assessment? Yes, no. And it's okay if you don't, or maybe the question is, do you have one that looks like this? Or because, you know, we go in and do infection control, those ICARs with facilities. And so we want to make sure that, you know, when we say risk assessment, sometimes they think about the emergency management risk assessment. So this is a particular one for infection control. So I do see more yeses than nos, but it's okay, because part of this is that we want to make sure that you have these resources, and we can email these out to you. I have this as a template. I've been carrying this around for 20 years. I really like this template, and it calculates it for you off to the right. I want to just start out at the top where it has that little star that says these assessments are made based on data, research, experience, and beliefs of those assessing the risk. So that's not you, the IP, or the director of nursing. It is your QAPI, your infection control committee. So the IP is going to initially fill out this form, but you need to have that higher committee that's looking or approving this. So you always want to think about geographic and the community environment. So what are those risks coming into your facility? You always want to have flu. You always want to have some sort of funky bug, you know, the multi-drug resistant organisms. Pandemic. Exposure to TB might be different based on your location. So Alaska, Hawaii, they're high TB states, but Wyoming, Montana aren't. I know Wyoming isn't. I don't know about Montana, but anyway, I assumed because you're kind of, you know, together. But exposure to TB might not be an issue for your community. But so think about your geographic and community. What are those things that are unique to your state? And then the potential for infection. And this is driven. So at the top where it says these assessments are based on data. So that's your surveillance data. That's your monthly CODIs or your UTIs or your skin infections, your respiratory infections, bloodstreams, C. diff, whatever. Now you're going to put it down. You're going to put them all down, all those potential infections that you have. and you're gonna give it a score. So let's just take UTIs, not CODIs. Line 18. What's the probability that this will occur in your facility? So based on previous year's data or previous, maybe half a year data, maybe you're having an increase in UTIs. So what's the probability that this will occur? Well, maybe it is moderate. Maybe the likelihood is because you're having an increase. So you're going to give it a 2. Move across the line. Now you're assessing that severity based on the UTI, not CODI related. So what's the possibility of morbidity or death? It's there. They could have sepsis, right? So, but you again may not have a whole lot of cases of sepsis. So you're going to give it a 1. The preparedness and internal response is really around policies and those process measures that you're looking at for your staff. So now maybe you're going to be looking at hand hygiene. Maybe you're going to be looking at peri-care. So how well are the staff complying or adhering to those processes based on your policy? So you give it, in this example, it's a 2 and 2, and then you give it a 37% risk. If you look to that far right risk column, you can see that actually the exposure to COVID-19 is 30%. That needs to be moved up. But every year I would do this. So at the end of the year, you have an idea of your top infections. You're going to categorize them and give them a score. You want to bring up your top 5, top 3, whatever you're going to be able to work on, and you're going to highlight them in yellow. So then that's going to drive you to your plan for the following year. So thinking about 2025 and how certain things would score out. When we do ICARs, we know that most of the infections are skin, maybe C. diff, but respiratory for sure. So, what about multi-drug resistant organisms? We know over half of residents might be colonized with an MDRO. So how does that fit into your risk assessment? And we can certainly send this out. This is my most favorite, and it already has the calculations in there. So you just plug in the numbers. Next slide. So I look at that as an outcome risk assessment. There's also this one that I call is a process improvement, or it's a process risk assessment. So you can see the potential risks to the left are more on the lack of hand hygiene, those failure of prevention activities, the lack of respiratory hygiene, and you could probably reword it, but low immunization rate, low pneumovax immunization. Maybe your enhanced barrier precautions, you've done some audits and maybe that's not, I don't know if I would say lack, maybe it's, I don't know, there's a better softer word, I suppose you can say, but it's the same process in that you have a rating. You go through the process of what are those risk areas. Maybe you guys do droplet precautions really well, but not so much enhanced barrier precautions. So that might score out higher for you to be working on in 2025. So we'll also send this out. I think this one came from APIC actually. So, these are tried and true. You can see the dates on these, 2010. So these are still great tools to use. Next slide. I think that's it for me. And one thing I am going to put in chat while I hand it back over to Callie is we just learned about a new tool, which is free and online, and it's called SLICE tool, SLICE. And it's the acronym is for Self-Led Infection Control Evaluation Tool. So it has 17 domains. Comes out of the University of Nebraska Medical Center, and they walk you through these domains. You can pick whatever you want, and it ends up giving you a report that you can then complete the following year, and it tracks your progress. So I haven't really gotten in there to play. I just was pretty impressed with it. So while we talk about infection control program, I just wanted to make sure you guys had access to that tool. And thank you. Back to you, Callie.
All right. Thanks, Kelly. Wonderful information there. we are doing a little teaser today on an updated resource. Some of you guys may be familiar with the Infection Prevention Quick Guide and Checklist. It was created in partnership with the Montana Department of Health and Human Services Epidemiology and Scientific Support Bureau. So I just want to give a shout out to them for creating this wonderful guide. We have taken this guide and we have updated it and we have expanded it. So let's go ahead and go to the next slide. And just going over this presentation today with Kelly just kind of reiterates how many different resources are out there, how many different checklists, tools, bundles, guides there are. And as an infection preventionist, it can become extremely overwhelming. And so we wanted to create kind of I'm not going to say a one stop, because just like she said, she put this presentation together and hey, now the University of Nebraska has created a new toolkit. So I don't think it's ever going to be all inclusive or it's ever going to be just a one-stop shop, but it's definitely a good spot to start. So this infection prevention quick guidance checklist, my recommendation to you guys is to download it, put it on your desktop, perhaps print a copy as well so that you guys can just write on it on the fly, on the go. You can actually write your checklists and you can, do whatever you need to do to make your notes. But I would definitely have it downloaded or at least readily accessible so that you guys can click on the links. So you'll see that the original checklist was 4 pages. It's now about 20 pages long. We have a couple of more edits and revisions, and then we will be sharing this out with you next week. So again, this is a little teaser to go hand in hand with Kelly's presentation today. But let's go ahead and see what we've added. So let's go ahead and go to the next slide. So we've added a couple of things. So becoming an infection preventionist, talking about the concepts, and then there's a couple of things that we didn't have a lot of information on. Antibiotic stewardship, looking at the environment of care. We've added some of our environmental services. You guys may remember the Project First Line training that came out with Donna Nurse and doing the environmental cleaning. Looking at the construction and what's required for that, the water management. Again, NHSN, it's always evolving, always changing. So we want to make sure you guys have some information on that. So we really tried to kind of expand each of these sections, identify some core concepts for each of those, and then put some links. And even in some of these areas, we have some training for you guys. So I'm going to share my screen now. And okay, can you guys see the infection prevention concepts?
Yes, we can.
Thank you. Okay, so on this one, a couple of years ago, we had a Wyoming Infection Prevention Summit. And from that summit, one of the things that the infection preventionist relayed was having some processes and just some checklists and some guides, easy to use kinds of things that they could apply to their work every day. So I actually had an infection preventionist share with me some of the checklists that she uses on a daily, weekly basis to guide the work that she does. So I've adopted some of those. So as you go about your week, your month, your day, you guys can take a look at a breakdown of all of the things that you need to do. Sorry, I pulled it up on the wrong page. So your daily tasks, preparing for your day, attending morning meetings, looking at your EMR, how many new admissions do you have? Are there any culture results that you're waiting on? So it's just kind of to help guide your day. And again, this is why I say, having this on a checklist might be helpful. Looking at your weekly tasks, looking at stock supplies, any rounding you may need to do, some chart review, and then looking at both monthly and monthly or quarterly, and then annual tasks. So again, just to kind of add to that, we did put knowing your resources, putting all of your contacts in there again. This may be something that's extremely helpful to have on hand. You can add, your account manager's email or phone number on there. So you guys have that right at your fingertips. You can pick up your guide and make those phone calls. And then this is just an example of one of the appendixes. So you'll see the antibiotic stewardship. We put some key resource links, but also some training in there. So you as an IP have some resources for training as well. So, all right, I'm going to go ahead and stop my sharing and we'll go back to the slides, Miranda. Anyway, with the infection prevention guide and resources, we just wanted to give you guys a good resource, again, kind of reiterate those key components of a infection prevention program. And as you guys start working on those items that you're working on, building for next year, the tasks that you want to work on, this will help you guide and make sure that you have all of those policies in place, all of those programs, your quality assurance, what you're reporting, and like I said, really help guide. So right now is a really good time to kind of do that review as we go into Infection Prevention Week. Remember all of those amazing things you guys have done over the past year. Take credit for those things. Make sure you're capturing that in your quality assurance and then build it into your programs for next year. So we'll just take a minute. Does anyone have any questions? I see in the chat, everyone loves Kelly's templates, so we'll make sure that we
Oh,
get those.
Get
It
those
looks like,
emailed out. Yeah, I'm trying to figure out how to add it to chat, but it's not working for me. So we'll just have to email them out.
okay, perfect. And then again, with the infection prevention quick guide and checklist, watch for that. That will be coming to you during Infection Prevention Week, our gift to you. And again, we appreciate our partnerships and everybody who's worked on that guide to make it a success and a great resource for you guys. Kelly, kudos to Kelly for all of her amazing work on that as well. And then, so like I said, watch your email next week. And then Kelly dropped the link in the chat for that Slice tool that she referenced. And then, as always, thank you for joining us. Please take a moment to fill out today's evaluation. We appreciate your feedback, and we will see you next week. And have a wonderful Infection Prevention Week next week. So make sure you guys celebrate all of the amazing things that you do.
Thank you.
Thank you.
Thanks, everyone.